Hey everyone, happy Tuesday. Welcome back to the live stream. I'm excited to be back here with you guys today. We're doing our standard kind of Q&A, answering questions about medical coding certifications, books, career options, all the great stuff that we have going on. I'm sure everyone's going to have a lot of questions about what's happening with 2025 and 2026 changes. I'm going to try and bring up my TikTok peeps as well. I have to switch over to the Contempo coding channel. I don't know if you guys know this, but I've had some requests, like people kind of want to know the Victoria personal life. So I've started some channels for just kind of like the Victoria behind the scenes, or what I guess now they call, there was a string of popular LinkedIn videos I was watching for a while that's called my 5 to 9 after my 9 to 5. So I guess that's what that would be considered. So yeah, I'm excited to be here today with you guys. Definitely let me know in the comments where you are tuning in from today. And if you are part of our replay crew, hit me up with a hashtag replay in the comments. I always love reading all the comments from you guys. And let's get started with today's live stream. Now, where is my... Here we go. Hey everyone, welcome to today's live stream. I see we got some people tuning in already from, I saw South Carolina in here. This is the first time that I'm testing out. There's a new feature where I can do standard landscape as well as vertical video on YouTube. So there's technically 2 YouTube live streams going on right now, which is crazy. Really excited for that. And so, yeah, we've got a lot of people coming in today. We've got South Carolina coming in. Good afternoon from Houston, Branson, Missouri. I haven't been to, I really need to get around more to other locations in the United States. We've got one coming in from Canada. So there's people, a lot of people don't know this. There's actually different coding systems that they use in different areas of the world. And Canada uses a very similar ICD-10 than we do, but there are some small differences. And we use ICD-10 CM in the United States. In Canada, they use ICD-10 CA, very, very similar. But I believe there are some slight differences. What those are, I couldn't tell you. I've not had the opportunity to dive into the differences. And I'm not sure if Canada's planning on moving to I-11. They might be doing that longer, sooner than us in the United States, because we can't seem to get our stuff together as far as that goes. Let me just, gosh, dropping my phone. Adjust my friends here in TikTok. If you guys aren't aware, I've actually been doing some more live streams right over to TikTok. I'm trying to kind of build my audience a little bit there. You've probably seen I've been doing a lot more YouTube shorts lately, trying to get that stuff together. And I have a whole batch of them coming in. I like to do a lot over the holidays because I know people are at home and they're, considering career changes or maybe have a little extra time on their hands because they've taken some vacation time. So I figure, well, why not fill that up with some Contempo coding stuff? Although right now I have a new book I want to read. I'm in the home studio today, which is chaos central. I usually don't like to live stream here as much because there's like so much going on in the background. I feel like people aren't going to pay attention to what I'm saying because there's like Figment and he's wearing a hat and there's this wicked backpack and then, these aren't new well, there are some new emos back there. The can't remember what those are called now, but the books and the Legos and everything. So this is kind of where I keep more of all of my menagerie of things and keep the studio that I rent out for my office, which is about 12-minute drive from here. I tend to keep that a little bit more clean looking, and then this is everything. But it feels good to me because it's all of my nerdiness. I'm getting excited because I'm a big fan of Stranger Things, and I'm counting down the days until the final season, which apparently they're breaking into three three different sections, which is gonna probably kill me. But yeah, so lots of books, and yes, that is my Sarah J. Maas section in the back. So question coming in from TikTok saying, "Are you doing a podcast?" So that's an interesting question. So I've done podcasts in the past. Podcast is not my super favorite thing to do, to be honest with you. And it's the thing that gets the least amount of views. However, I really enjoy getting to go to the conferences and talk to the people and be there in person and interview them. I think it's a little bit more interesting to do that than just have like an audio podcast or do it via Zoom. I haven't gotten to the last conference, but it's just then the in-between time of trying to fill that podcast space. Like, it's a lot. A podcast is a lot. So I want to continue to do some interview style material, but that's going to have to get kind of reinvented, I think. Sometimes those interviews are just not, they just don't perform well. And they're great and I love doing them and I love showcasing people. But yeah, it's not it's not my best performing content. I have to figure out something else to kind of pull people in. Recently, what I did, and this was kind of disappointing, I want to do a video about like what employers are looking for in medical coding and talk about like, is there a special certification? Like, is there a way to prep for AI? Like, what boots on the ground people can tell me like is going on right now? People who are hiring medical coders because they're in a management role or recruiters. And so far I've not I've not really heard back from a lot of the people that I contacted. I had one recruiter who I've met at conferences and talked to and emailed, and I don't know if my emails go into spam or what, but I've not heard back from him. I do have someone who is a senior VP, I think, at a very large recruiting group who said he'll get back to me. So we'll see. I think it would be cool to do more of kind of my typical career content and medical coding content and then bring people in to make like commentary for that. So that's what I think we're going to try next versus the more podcast format. So hopefully some people will get back to me. And I feel bad because I'm literally the slowest and worst person at getting back to people. And now I'm getting, I guess, maybe a taste of my own medicine. Wow, we're coming in a lot from TikTok today. Would love to listen. Where did you get your education or gain credentials at? That's what they're asking on TikTok. So I've been a medical coder now for over 15 years. Back when I got into medical coding, there wasn't really like an associate's degree program like there is now. If I was going back in time, I'm not sure if I might go back for my associate's degree. I think it's hard to tell. But at the time, I had gone to college for web design and decided I wanted to pivot. That wasn't for me anymore. And I was working a lot of jobs, just administrative temp type jobs, and decided I wanted something specialized. So I went to Reading Community College. I'm in northeastern Pennsylvania, near the kind of Reading Allentown area. And I went to Reading Community College because that's where I had gone for web design. And I said, hey, I'm thinking about getting into medical coding. Maybe I should switch my degree over to medical administration, I think it was, because I want to get into medical coding, and that looks like it covers part of that. And they told me, hey, you don't actually want to be here. You want to be across the street where we have our business and career programs, and we have one for medical insurance specialists. So that's where I went. I got a certificate from my local community college. I got a job working for what is now Tower Health. At the time was Reading Hospital Medical Group. and was working there for a little while doing charge entry. And they said, we really are going to need some coders. We're buying up all of the physician practices in the area, and we're going to need some certified coders. We're going to bring in a coding instructor. And if you want to train to take your CPC and you pass, we will reimburse you the cost. So I scrambled to get some money together. I was living with my parents at the time, so it wasn't, you know, as hard it would be as if I was on my own and had a family to support and so forth. So I took the course with a certified instructor, as well as many of my colleagues took the course as well with them. Half of them passed, half of them did not. I was luckily in the half that did pass. I had to haul my butt out to Hershey, Pennsylvania at the time, which is a little over an hour from me, in order to take the exam. And that was so long ago that it was pre-Google Maps. I had, I think, a TomTom at the time to navigate me to Hershey Medical Center to take my certification. And yeah, so they reimbursed for that one. And that was, I think, the only one that I was actually reimbursed for through my employers. After that, I got the auditing certification, then plastic and reconstructive surgery, which has been sunset since then. Uh, I get to keep my certification. I still have to get CEUs for it, but no one else is allowed to test for it because the upkeep costs were just not being offset by the income that they were getting from people who actually wanted to test for that certification. But yeah, I don't even know how many certifications I have right now. 8, maybe, something like that. CPC, outpatient, inpatient risk adjustment, plastic surgery, family practice, dermatology, and instructor. I think that's all of them. I have so many now that I don't think all of them are even hanging up. Elle says she has her RHIT, CPC, CDO, and CRC. That's awesome. Yeah, a lot of people think that the RHIT can get them a coding job, but there's a lot of employers that really don't consider the RHIT a coding credential, even though it really is an advanced credential. Like, you have to go through an associate's degree program that is approved by a HEMA to sit even for the RHIT. But I guess coding's only a portion of it. So a lot of employers, they want you to get a coding credential. And I've dealt with that in the past. I had an employee when I was back working at Lancaster that had their RHIT. And in order to move up into an advanced coding role, they're like, yeah, you have to get your CPC or your CCSP, like a specifically coding oriented credential. Erica says, I know this is off subject, but I just got approved as an AEPC instructor. Awesome. Fun fact, I attended a school in 2020 that used to show us your videos for learning tools. Yeah, back in 2020, there really wasn't a lot. I I don't want to say that I forged the trail there, because CCO was doing it a lot longer than I have. I think medical coding with Blue had been around for maybe a year or so prior, but I definitely gave it a different spin, and maybe had a different quality level than some of the others at that time. What do you suggest on studying tips for the CPC exam? I take it next week, but struggling on what to study. So a couple of really important things, and actually let me bring up my screen here. There's a video on my channel that is like the one that you want to watch. So I could actually have renamed this video, "Watch this before you take your CPC exam," because this is the stuff you need to know. But it's actually the most common concepts for the CPC exam that trip people up, and ones that they tend to cover more frequently. So, we have between ICD-10-CM, CPT HCPCS, like 100,000 codes, right? So it's hard to figure out, like, what are the ones they're going to test you on for the exam. There are certain concepts that they tend to focus on because they're important concepts or we see more frequently. So like things like complex OB questions, certain types of skin lesions, they might have multiple variants of questions on those concepts, which means that in their exam bank of like 1,000+ questions that they have, it's more likely that those types of questions are going to appear. So let me bring that up. The thing about having TikTok up at the same time I'm trying to live stream is my texts and everything and voicemails are coming up. And I was at EDC, which is a rave, about a week and a half ago. And now my friend's like, "What are you doing in April? We can go to another one." I'm like, "No, why? Why are you doing this to me?" So yeah, let me show you the video that I'm talking about. That's the most, oh, there it is. Okay, hold on. Let's screen share over. And TikTok people, I'm just going to move the camera over to show you guys this because I don't have screen share capability with you guys yet. StreamYard needs to get on that. Window, Chrome tab. Here we go. Okay. So the video that you want to check out is this one. And it is called, let's see if I can do this over here. It's called Most Missed CPC Exam Questions and How to Get Them Right. That is absolutely the video you want to watch before taking your CPC exam. And TikTok people, let me switch you around. I'm going to show you because this is the only way I can do this. Flip camera. Yeah, so it's this video here. The top misconceptions. Oh, wait, hold on. Most missed CPC exam questions and how to get them right. That's the video that you want to watch right before you take your CPC exam because it's going to go over the concepts that will very likely appear on your exam. I've had people tell me, like, I watched that video and yeah, Victoria, like, you were completely right. Like, that's the type of stuff that did appear on my exam. And I think I got them right because you covered them on that video. The other thing I will recommend is there is practice exams from the AAPC. Those are amazing because they mimic the actual exam. It's in the same platform. So you can get used to, how do I open and close the timer? How do I skip around questions? And it's in that nice safe environment so you don't have to do it on live. So that's what I would recommend. That video, the CPC practice exams from the AAPC, and the study guide. Sometimes they have bundles. Actually, let's take a look and see what they got going on right now. Because they've got their Black Friday deals going on. Let's see what we can find. Where is it? Where is it? Come on. Stop share. Hold on. I'm going to share over here at this tab. There we go. All right. What Black Friday deals do we have going on right now? Shop events, 50% off. Black Friday. Let's see if they've got anything coming up, because a lot of times they have really good Black Friday deals where they will cover some pretty cool stuff. All right, let's see. Specialty training. Oh, yeah. If you need specialty training, now's a good time to do that. This ends in 12 hours. I think they're doing the training study guide and practice exam with exam purchase for cheap. I still have the unlimited one for where I have access to all of the certification prep through the AAPC, but one at a time. So far, I think I've gone through maybe like 3 of them in the past, like 2.5, 3 years. And let's see. So free books, Profi Coder, Complete Coder. I'm not seeing anything right now for the practice exams other than the specialty ones. Specialty certificate courses, $100 off. Yeah. Nothing good right now. But yeah, those are the ones that I recommend. I'm actually working on some additional study materials right now. I've been going through and creating some practice materials you can purchase as an add-on or separately with the review course that I have. And I have someone else that's helping me create questions as well. Trying to build a database of questions for videos, for practice materials, a mix of CPC exam style stuff that's multiple choice, and then also some fill in the blank cases as well. It's a lot to create it, though. Erica Smith says, I cannot wait to attend HealthCon. I think I'm going this year. I'm still not 100% sure. I know I had talked to Alex and he said he could maybe get me in for free. We'll see. We'll see how it goes. We'll see how it goes. I'm hoping to attend. I think it's what, May? They put it over May the 4th this year, which is I'm kind of sad about because I wanted to be at Disneyland in May for Bats Day, which I think is like May 3rd and then May 4th, may the 4th be with you. So I'm hoping I'll be at HealthCon this year in Dallas, but we'll have to see. I have a question here. Hi, Victoria. What coding and tabular book would you encourage for a home health RN hoping to get certified in HCSD? That is not a certification that I have a lot of experience with. So unfortunately, I don't have any advice on that. But if anyone in the comments has their HCSD and has some recommendations, please let us know. And I'll keep an eye on to Instagram and TikTok as well in case they have anything. Speaking of TikTok, what do we got going on here? I know I've seen a ton of stuff coming through. What is the best cheat code for studying PCS codes? I don't really think there's anything in particular that stands out. I used some flashcards. I used some study materials. For me, when I was studying PCS, it was because I was prepping for the CIC certification. So I found the CIC course material helpful. I think I actually got some of it went back when they were having the true free AAPC a while back. So that course material I found helpful. I don't know that it's necessarily helpful for everyone. One thing I liked was I had my book read to me by Speechify, so I could do more of an immersive learning experience. So I was reading and then also having it the auditory stuff going on as well, so that I could read and learn. Do you have an intro video on how to use the HCPCS 2 book? I do. And I recently did one where I've just gone through HCPCS cases because it's not covered a lot. And honestly, if you know CPT coding, HCPCS is so intuitive. It runs on the same kind of system. And a lot of organizations don't cover much of it for a couple of reasons. First off, when we look at what is covered on the CPC exam, there's only, I think, 3 HCPCS questions, 2 or 3. So technically speaking, I've had people tell me I didn't even bring my HCPCS book and I still passed the exam. So it's not a huge focus during education. And if you know CPT, it's already very, very intuitive. So what was happening was a lot of schools were making students purchase a CPT book, an ICD-10-CM book, and a HCPCS book. And the HCPCS was only covered for maybe a day, half a day. And students would get so upset. They're like, I can't believe you made me pay $80, $90 for this book. And then we only talked about it for 2 hours. Why didn't you just give me, a worksheet or something or an instructional? Like, why did you make me have to buy this? So some schools opted to just not even provide HCPCS books anymore because they were getting so many complaints from people that are like, why are you making me buy this? Because keep in mind, with a lot of schools that have various clinical trainings, sometimes people like medical assistants and things might have to take an entry-level coding class, but they, I don't want to have to spend all the money on coding books and stuff. When I used to teach at a tech school, I taught medical coding 101 to medical coding students, HIM students, and medical assistants and medical secretaries. Kelly Gray says, hi, I'm planning to take the CPC exam in the near future. I also want to study up on billing. Do you have any other advice other than to take a full course for learning? Yeah, billing and coding are 2 sides to the same coin. You can get training if you want through Preppy. Preppy does billing and coding training. It is a little bit more geared towards the CPC. And the AAPC has a combined CPB and CPC training as well. Around this time of year is a good opportunity to look for discounts, because Black Friday, New Year, New You, like they tend to have a lot of discounts on that. But also check with some of your local schools or technical institutes, because you might have grants that you can get. Your employer might have a certain education system that they use that they will reimburse part or full for. So look into difference, but you can never go wrong with just going right through the AAPC. Question on TikTok says, I'm doing the billing course through the AAPC. Does Speechify have that too? I feel like I'm not absorbing the info. So you have to purchase Speechify. I think I might have a discount link. I don't think I have it in my descriptions right now. I'll have to look for it then. But yeah, Speechify is cool. It's an app that you can get, and you can also have it just like on your desktop, and it will read things for you. I think sometimes, depending on what you're reading, it doesn't always integrate. Like I think the Vital Source bookshelf, it doesn't. But that has an e-reader in it. It's just, you can also take photos of things and it will read the photos, which is a little bit, a longer process, but I like it for that. Can I rent a HCPCS book for my upcoming test? Mine is from 2023. My ICD-10 and CPT are good. So there's a couple of options there. One of the things is when you redeem an exam voucher with the AAPC, you have two options. Option one is I will bring my own physical paper books. I'll make sure that they're official ones, that they're the right editions, right publishers, right years. And then you take on that responsibility. Option two is I will elect to use ebooks. And then when you go in to take your exam and you log in, the ebooks will be automatically embedded in the exam, the right years and everything that you need. You cannot use a mix of both, so you can't use part ebooks and part textbooks. So as far as if you don't have the right year's books, because the AAPC is based off of calendar year, so you have to use either the current calendar year book or one calendar year prior. So 2023 you wouldn't be able to use. There might be places you can rent from. I recently actually saw that the step-by-step medical coding books for learning medical coding are at my local library. And that's inspired me that I'm going to talk to my library and see if I can donate a full set of code books to them for 2026. And that way students who maybe need to borrow a book, or people who are like, I want to learn medical coding and I just want to see if this is for me before I commit into any kind of financial stuff, like they can go out and borrow the books. So check your library to see if they have them. Sometimes your local chapter might have someone who, out of the kindness of their heart, will loan out the books, but those would be your best options. Vanessa says, you're a great professor. You are great. My professor shares your videos all the time. That's what I love to hear. That I've made materials that just make the instructors' lives a little bit easier too. I have the YouTube membership for this channel. How often will you post case study videos? They're kind of random, to be honest with you. It isn't at a set schedule, but there are some available right now. The membership is a little bit more so to support the channel versus having a ton of freebies, because those are kind of at whim, I suppose. Does Preppy have a discount for the exam? Not that I'm aware of. Preppy is kind of a general training, so the cost for membership and exam is not included with Preppy, because not everyone wants to take the exam. They might get to it wouldn't be fair to include, I feel like, the exam fees, which are going to up the cost an extra at least $400 plus membership. If some people might get through the course and go, yeah, no, never mind, I don't want to take that. And now we've upped this and made them pay all this money for something that maybe they decided they don't want to take or don't want to take now. So that isn't included. That's a separate. I don't believe there is a discount for taking the CPC exam. There is currently, though, a discount for Preppy. The problem is I keep getting the advertisements through sponsored videos that are appearing on my various feed. Oh, there it is. Actually, I can share it to you right now. So I can show you, there is a discount right now with Preppy. I'm glad I can, I'm glad it's actually showing right now. Let's see if I can do a share screen to show it to you. Share screen. I wonder if I can do part of my screen here. I can't. Okay. Window, entire screen. Okay. So there is a sale going on right now with Preppy. If you use the code Black Friday at checkout, all one word, Black Friday, and you can save $199. This is the first time I have ever seen them do a discount. It is likely, it may very well be the last time I see them do a discount. I can't guarantee that they will ever do this. This is literally the first time I've ever seen them give a discount on the course. If you're not familiar with Preppy is the program that I recommend for medical billing and coding programs. For training, there's someone that was just on TikTok saying they started in October and they love it. And it does great training geared towards the CPC exam. What I will tell you about Preppy is an on-demand program. It includes an externship opportunity. If you pay in full, they'll include a Chromebook with you. And it's a very affordable option. And they have really great customer support, and they have career support as well. So it is a great budget-friendly option. If you, however, are someone who wants to get a program where you're like, I want to meet with an instructor every week, that's going to cost you more. If you're someone who wants a program who are like, I want all the bells and whistles, I want my books included, I want my exam included, I want, membership included, I want study guides and all this other stuff, the more that you're going to have included in the program, the higher you're going to have to pay. But if you're looking for an on-demand, budget-friendly option that you don't have to take out student loan debts and everything, Preppy is a very, very excellent option. You can find out more about them by going to preppy.org, and they have information, or you can sign up for my free career masterclass at medicalcodingmasterclass.com. Are there any options to just listen to the guidelines of the code books, audiobooks, or YouTube videos, etc.? I feel like that would be an amazing study tool. Stay tuned. I am working on that, at least for ICD-10-CM. Because of the AMA and their tight-knit guidelines with CPT, I don't foresee that happening. But ICD-10-CM, yeah, I'm actually working on an audio version of that. Hi, I received my CPC in April and the A is gone. Yes, love that. Having time finding a career coder position, even with the company I work for as a claims processor, should I add another certification for assistance? It's not a bad idea. I always think it's a good idea to have your auditing certification in your back pocket, especially if you've already got your A removed, like you're solid in your job, and you are, just looking for the next step. Is it going to immediately get you an auditing position? No. Is it going to show, though, that you have dedication? Yeah. I would also recommend, if you're not already, getting in touch with your local chapter. So you can find your local chapter on your AAPC website, and they have lots of events. Some of them have cool networking events. It depends on what chapter you're with. Remote, in person, they have just a lot to offer. Some of them, depending on your chapter, some of them are a little, minimal, we'll say. Not as enthusiastic as some of them. Like, there's some chapters that are amazing. The Puerto Rico chapter, phenomenal. They're on top of things. Orange, Irvine, California, amazing chapter. Philadelphia, great chapter. But some of them, they're just kind of, they're sludging along, but you can switch your chapter. You are assigned automatically a local chapter based off of your location and the zip code of the closest chapter to you, based off of where you are. If you go to your AAPC page, let's go over here. Oh, that's not what I wanted to do. Okay, hold on. Remove, stop screen. There we go. We'll start sharing where they are over here, window. So if you go to your AAPC page here, and you go to your profile and then to local chapter. It will show you your local chapter information. Here's my chapter. Come on, where is it? Chapter events. Chapter overview. It's probably under that. No. Oh my God, AAPC. Why do you not have this where you should be? Find a local chapter. No wonder people are getting so confused. Excuse me. So let me stop sharing this for a second so I can click around. Oh, maybe it's under here. Hold on. Training and events, local chapter events. Excuse me. Where is this going to take me back to find a local chapter? Training and events, local chapter events. No. It used to be, I don't know where it shows you where your local chapter is now anymore, because it used to just be right there. Did I lose my membership and not realize it or something, Victoria? Oh my gosh. That almost happened to me once. I almost lost my membership once or twice. It happens to even the best of us, because I think I was at my renewal date for CEUs or something and hadn't submitted them. Like I had them, but I forgot to hit the submit button. Let's see here. Where is it? I just want to make sure, because I know it's under my profile, but I don't want to show you my profile completely because it will have like my address and stuff on it right there. Okay, there we go. Local chapter, view events. No events currently for my chapter. Okay. So what you can do is you go to your profile and then go to the button that says local chapter, and it should show you your local chapter. You also get emailed, or I think maybe physically mailed, the contact information for your local chapter. And they should send you emails when they're having events. Candy says, I'm worried about the job force. As I look at job requirements, I rarely see CPCA as a qualification. A lot of organizations, well, I shouldn't say a lot of organizations. Sometimes when they put these job descriptions together, they don't differentiate between the CPC and the CPCA. So it might be that they might take CPCAs. It's just that whoever is putting these job descriptions together doesn't understand. They were just told CPC and they just put down CPC. So what I recommend is if you're looking for a job and you're very entry level and you might have like a CPCA and not a full CPC yet, go into your Indeed.com, your LinkedIn, or Google Jobs, wherever you're searching for jobs. And instead of typing in CPCA, because you will then get some job options that say no CPCAs, so that's not going to do you any good. I recommend just searching for a keyword that will bring up jobs where they're looking for skills in medical coding. So if you search ICD-10, ICD-10 is used in all medical coding jobs. It's used in professional fee, outpatient risk adjustment. It's used in inpatient. It's also used in revenue cycle jobs. It's used in all kinds of different jobs where they're looking for someone who has a skill set in ICD. So when you're searching, just type ICD and you will get a wider net that you can cast of jobs that you might be able to qualify for. So some of them might not have that title of medical coder, which is what you're only going to get when you search for medical coder or medical coding in a job search. But you'll get some other options in there. So they might be things like calling for prior authorizations. It might be things like doing some billing reviews or accounts receivable that are kind of coding adjacent and then can hopefully get you into a coding position and transfer it into something a little bit faster. Shaleigh Sloan says, I have been a medical coder for 2 years and did self-study when I took my CPC exam. I have the letter from my director with the length of my employment as a coder. Where does it upload at the CPC? Or I'm sorry, with the AAPC. What you do is go into Google and type CPC remove your A. And that should take you to the page on the AAPC website. So CPC, remove your A. And then when you do that, likely the first thing that's going to come up is your apprenticeship status, search results, apprenticeship status removal requirements. And then, is it at the bottom or is it over here? Let's see. Apprentice removal application. And that's where you type your member ID, last name, and then you can verify and upload all your information to get your apprenticeship status removed. So for those of you who don't know about the apprenticeship status, when you sit for the CPC exam, if you do not have 2 years experience or what's considered the equivalent, you will automatically be designated a CPC-A or CPC apprentice. There's a couple of ways to fast track that removal in lieu of 2 years experience. One of them is if you go through a training program that has 80 contact hours of education and they can submit either a transcript or some kind of certificate saying that you had 80 contact hours of medical coding training. Preppy does include that. They have the 80 contact hours that can help you get your apprenticeship status removed faster. Second is you have to do Practicode. Practicode is medical coding cases that there are not multiple choice. They're just like fill in as many codes as there are here, and they don't tell you if it's 2 codes or 5 codes, if they're CPTs or 5 of them, if there's 10 ICD-10 CMs or 2 ICD-10 CMs, they're just blanks and you fill them in. It is difficult. There isn't a ton of support for it, but if you complete that accurately, you can also remove a year off the apprenticeship status. So technically speaking, you can go in as someone who doesn't have any experience in medical coding, get your CPC-A. If you went through the 80 contact hours of training and you can finish Practicode, you can get your apprenticeship status removed a lot faster. Shirley says, okay, did that. And it asked me for an end date on my employment. I'm still working. I don't know how to get around that. It has a red mark beside it. I would maybe just either put in today's date or maybe contact AEPC customer service if that's a website issue that it's not allowing you to go forward. Could work experience as a medical biller count towards removing the A from the AEP from the CPC-A? So the requirement is that you work with medical codes. So if you're working in any capacity with medical codes, that would count towards your years for apprenticeship status or your experience for apprenticeship status removal. It's not that your title has to be medical coder or medical coding specialist. It's that you have to prove that you are working with medical codes. Monica says, Practicode is hard. It makes me feel I'm too stupid to get a job if I ever manage to get an interview. Yeah, it is. It is tough. There's another comment here from Nina saying, doing Practicode right now, it's tough, but I'm learning a lot just by sending them my questions on the cases. Nina, let me know how the response is for them, because I know historically there's been a lack of response when you're asking questions on Practicode, but I know they've made a lot of changes with it recently, and I haven't had a chance to kind of dive into what's kind of new and improved with the Practicode 2.0, I think they're calling it. Let me get into Instagram here. Hologram says, I recently passed my CPC and am working in an EMR to audit AWVs. AWVs are the Medicare Annual Wellness Visit. It's their version of a preventative exam. So instead of it being like we're going to check your heart and lungs, it's more of a like, do you have objects in your household that you might trip over? Do you have any medication insecurity? They do a visual acuity exam. They do the the man, woman, person, TV exam, the cognitive exam. And I am so confused on the sequencing of diagnosis. Does this make any sense? So when we talk about sequencing diagnoses. We have certain sequencing guidelines, right? So for example, if a patient's coming in for cancer treatment, we have certain guidelines of how that gets sequenced. If they have an acute and chronic variation of the same condition, we have sequencing regulations surrounding that. But outside of that, it technically doesn't matter. When we're talking though about annual wellness visits, a lot of times that's our opportunity to get out those risk adjustment diagnoses. And we can only put so many on a claim form, right? So we want to make sure that the ones that risk adjust are on top. From technically speaking, as far as sequencing guidelines, if you've got something like diabetes and then you've got a hangnail, there is no sequencing guideline saying that one has to go prior to the other or before the other. So there's no regulation. Coding them either way would be correct. We can even see this in some of our CPC practice questions that we have that are fill in the blank for the CPC exam. Don't panic about that. The fill in the blanks are only for the practice exams. They have not put those in the actual exam yet. I don't think they will for 2026. Otherwise, they would have announced it yet. But you can see that when they give you the answers, they're like, yeah, we would accept these diagnosis codes in these different orders. So in lieu of there being a guideline, it technically doesn't matter for diagnosis codes. There are, again, like risk adjustment, we want to try and put the more complex ones that might risk adjust at the top to make sure that those go out. Other than that, if there's not a sequencing guideline, there's technically no right or wrong way to sequence them. We just kind of try to put them. Some people have regulations in their organization that say put them in the order the provider lists them. CPT, we do want to have them ordered in a certain way. We want to go from the highest relative value unit to the lowest one, or what we consider the more complex procedures or CPT codes to the lower ones, only because if we have one CPT code that has a higher RVU, that tends to be reimbursed much higher. And some insurances, they'll say, okay, well, the first listed CPT code on the claim form, we're going to pay you 100% of that. But the second one, we're only going to pay you 50%, and the third one, 50%. And then maybe, it's going to decrease after that. Maybe the fifth one, we don't even pay you for. So because of that, we want to make sure that the highest RVU and highest, most expensive CPT code is first on the claim so that we can get the most reimbursement from the insurance company. Rhonda asks, is there a fast track program for someone who has coded in the past? There might be some. I know there's people who have done like weekend boot camps, and I've heard mixed reviews of that. I don't know that that's as good of an option these days. There's certainly self-study options. So let's say you've coded in the past, you're pretty confident. I would recommend maybe get the CPC study guide and the practice exams and see how you do. So if you're doing pretty well on them, you're like, hey, I'm getting an 80% on all these practice questions. You might be like, hey, you know what? I'm ready. Let's go take the CPC exam. There's also some books that you can kind of go through to self-study or confirm what your knowledge might be or some areas that you need to improve on. The one I like is called Step-by-Step Medical Coding. My library actually has it for borrow. So you can go to the library in my area and borrow the Step-by-Step Medical Coding book. I'll show you what it looks like. I have the current year version in my ebook shelf, but you can also buy physical copies on Amazon. And it's the one that I used to teach with. And it does have practice cases. It only has maybe 75, 80% of the answers though. So not all of them. So this is present share screen. There we go. So this is the Step-by-Step Medical Coding books by Bucks. They are great. I believe these are the ones that Preppy uses unless they've recently changed it. But I love them. I think that they're great. They're great for learning medical coding. They include a lot of, you can see like exercise practice. You can also buy it on Amazon. I don't know when the 2026, the 2026 version's coming out Monday, December 29th. So yeah, you can get that. And they also have a workbook available as well. That's just practice cases. But if you're someone who's pretty confident in your coding and you're like, yeah, I just want to go ahead and get the certification, you can get the practice exams and the study guide, and you're probably going to be pretty good with that. Mobile Laboratory USA says, Victoria, do you do private consultations? So I really love doing my YouTube channel, and I really love talking about medical coding and taking on small projects. I really don't like to do consulting. So it's not that I'm not someone who wants to work 50, 60 hours a week, and I'm kind of booked as it is. I'm not trying to build an empire, make $1 million. So if you're looking for someone who you're like, hey, we want a medical coder to test us out and tell us that we like this product or whatever, that's not me. You want me to help promote your product that's already done? I might be able to help you out with that if you want to share it with me and I look at it and I go, yeah, this is a good product. But as far as like, we want a medical coder to help us out with it, I might be able to direct you to some people, but it's not something that I have any genuine interest in doing. It's not aligned with my current goals. Will you share what the books look like? Jules, can you let me know which books you're talking about? Are you talking about the step-by-step books that I was just looking at, or like the actual code books? Hoping to take the test next month. My process felt rushed. 4 to 5 months. Words of encouragement needed. Okay. Jules, this is what you need to do. I'm going to tell you right now. You can do this. You need a couple of things. Go on my YouTube channel, and there is a video called Most Missed CPC Exam Questions and How to Get Them Right. Go through that. I also want you to go into Google. Go into Google and type cco.us CPC practice exam. They have a free practice exam that you can test out. I think it's maybe 50 questions or something. Like it's like 30 or 40 or 50 questions. It's an odd number. It's not 100. So those are 2 awesome free resources that you can have. Go through your study materials, whatever program you went through, and you have the materials, read through them, go through them again. But those are the 2 top things you need is that Most Missed Concepts video. Go through your materials. If you can afford the CPC study guide, or if you can afford the CPC practice exams, get those as well. They're great. Free prep exam. Yeah. So the cco.us, and I'll show you guys here on screen share, and let me actually flip you guys over and see if I can get that to go. Yeah, no, we're not getting into Goodreads. We're going into Google. I wish I was in Goodreads right now. There's a book that came out today that I really want to read, but hold on one second, the website again, because I know you guys missed that. All right. I'm going to flip this over for you guys so you can see what I'm doing. All right. So we're here in my good friend Google. What we're going to do with my good friend Google is we're going to go cco. Come on, Google, not over there. cco.us free practice exam. Enter. And right there, our first result is this free CPC practice exam. It's a 50-question practice exam. In order to get access to that, because they're giving it to you for free, they're going to want your email address. So that's the caveat. They're going to put you on your email list, but you can get that. The website itself, again, I just like to go into Google and type in CCO free CPC practice exam. But the official URL is www.cco.us/free-cpc-online-practice-exam. But you can just go into Google and type in CCO free CPC practice exam. Now you were asking about the Bucks book. This is the Bucks step-by-step medical coding book. It's the one that I used to teach with at the technical school that I used to work for. It's called Step-by-Step Medical Coding. My library actually has this that you can borrow it. So check your library to see if they have it available. You can also get it on Amazon. There is a workbook that's just practice cases. The step-by-step medical coding book itself is a textbook to kind of teach you medical coding, and it does have practice cases and stuff in it as well. Yep. I'm working on developing some practice cases. Those won't be for free. They will be for purchase. I am dedicating some though to do practice like videos on. But right now I'm kind of working on building a library, and I have someone else that I've contracted with to start building a lot of like mock kind of questions, so that I have a library of questions for videos, for practice materials that I will sell, case studies, all that good stuff, as well as the community questions. I know I haven't done those in a while, and you guys are probably missing them. Yeah, Roxy's saying some of the practice exams may be included with your package. I found out that 3 were already included in mine because I was actually trying to purchase them over the phone. Yeah. So sometimes they do have specials where they will include them at no additional cost, like if you buy an exam voucher and stuff. But other times they do have bundles where once you kind of add in the exam and the practice exam and the study guide, it'll be an increased cost, but not as much as if you were buying them all individually. Yeah, I need some guidance on billing. That's why I asked about private consultation. Yeah, I would love to help you out, but I'm not the person to help out with that. I'm not always the best, especially with billing stuff or lab stuff. Will AAPC have Black Friday deals? They have been offering some. They're on the website right now. But nothing with exam vouchers or study materials, unless you're getting, it looks like, oh, actually, hold on. That's specialty training. Yeah, a lot of the stuff they're having right now is for the specialty certifications, not for like the CPC. It's very rare that I've seen discounts on exam vouchers. What I do see more is usually twice a year they'll run a special where if you buy an exam voucher, they'll include the practice exam, and they will include the study guide in it at no additional cost. I've noticed they've been using the ebooks a lot more to issue with different things that they're selling. I used to, back in the day, they used to sell off the study guides at the end of the year. So like they would have all the different specialty guides for like CPMA and COC and CEMC and CCC and all that stuff. And they'd want to get rid of their stock at the end of the year. So they would discount them and you could buy them for like $20, which I love because they would only change like 3% of what was in the guides anyway. But they wanted to get rid of all their printed stock. And I haven't seen them do that now in years. And I miss that. All right. I'm going to take one more question. $20. It was like so cheap back then because they just wanted to get rid of all their printed stock. But now they use the ebook, so they don't probably have as many. Is the Coursera courses for medical coding fundamentals any good or worth it? I'm confused about what's going on with this whole Coursera thing, right? Because I'm not sure if these are, excuse me. Well, there we go. I'm not sure if these are official courses that the AAPC is like, yeah, we know about these and we're okay with it, or if it's an independent instructor, because it doesn't make sense to me that the AAPC would sell something on their website for, let's say, $2,000 and then offer it on Coursera for $500. So I don't know if those are actually the same as the AAPC, if it's an independent instructor selling them, or if it's someone who's like, I don't care, I ripped off everything and just stuck it on Coursera. I have no idea what's going on with the Coursera stuff. So yeah, unfortunately, I can't really vouch for what's going on there. All right. I am going to, I'm going to, all right. So we are at it says AAPC on Coursera, but there's practice materials out there that say they're the AAPC CPC study guide, and they're not. They're from some off-brand, some guy who just made a bunch of crap together that he stole from, old practice quizzes online and just slopped together in a selling online. So I really don't know if they are appropriately using those terms or if it genuinely is something that is approved by the AAPC, because people will just slap that on there when they're in the I have no idea what's going on with this Coursera thing. It's odd to me. It's odd to me. We need a video on the difference between the 2025 and 2026 books. So whatever code changes there are for the code books, that's all that's going to change in the books. As far as what's the differences between the textbooks, it's usually they only change like 2-3% of it, a couple paragraphs here and there. But yeah, I have a video on the ICD 10-CM changes from 2025 to 2026. I probably won't do one on CPT. I am having some new tabbing videos though coming up. But in any case, that is the end of our time. I will see you guys next time for the live stream. And until then, just keep on coding on.